I'll introduce. Okay. I'm introducing Tulsi Trust, an NGO which was established in 1975 by the Chandrai family. The goal was to fulfill needs of the poor and needy. Its main concerns include healthcare, skills development, and education. Graceful Living is an arm of Tulsi Trust, which emerged out of a realization of a social need for elder care. Graceful Living has created an awareness through its activities and talks for senior citizens. Today we present Dr. Sudeshna Ray, who is a senior gynecologist practicing since the last 24 years. She believes in empowering women with adequate knowledge about their own health so they can understand their bodies and make proper decisions. Her forte includes non-surgical options and keyhole procedures. She was lauded by the Government of India in 2021 for her contribution during the pandemic. Today, she will address women's issues in the Zoom talk. Yes, doctor, you can go ahead.
Very good evening to all of you. Can you all hear me? Can you all see me?
Yeah, we can hear you. Yeah.
Okay. A very good, very, very warm evening to all of you. Thank you very much, Graceful Living, giving me this opportunity to interact uh, with women of matured age, as we say. So I can talk on women's health across the ages. Okay, so when I was sitting and making the presentation for all of you people, then I also have my mother with me, and I was just talking to her about what would she want to know. Then she gave me a list of things which I felt, but this is not your anything to do with your age. Then she said, but you are I have come to you to know about women's health, to know about my health, to know about my family's health. So why will I restrict myself to know only about myself? Okay, so that's where I thought, and my PPT actually has across the ages, whatever questions she wanted, she had in her mind. I've tried to put in all across the ages. So let me share the PPT. So, if you see the things, there are like, so I've got across ages. However, let me begin with her, because I thought this is the age that most of them, like from here, most of you who are participating in today's discussion will be from this age onwards. So I thought I'll introduce Meenakshi to you, and then I'll introduce someone else to you. And then through Meenakshi and through the other women, you will come to know about the problems that they are having, and some of you might relate to the same problems there. So Meenakshi is 50 years. She's a homemaker. She had two children. She has two children who are grown up now and completely on their own. The husband is very busy at work. Uh, her menstrual cycles have stopped about a year back. Of late, she's not feeling too well and too comfortable. So what are her main problems? What can be the reason? So if you think about it, now the questions that come to my mind is, what can be the reason for her feeling so low and having some strange symptoms? She's feeling like, first of all, she's feeling that she might not be needed anymore. She's not needed any more by her children. Her husband is so busy that she doesn't have time to talk to anyone in the family. She feels that at one point of time, they were all so dependent on me, and they are now so independent that I have no role to play in my own world. Okay. And this leads to her feeling sometimes low, sometimes depressed. She feels that to some extent, she sometimes feels that, there's no meaning for my life. Strange. She's a very independent woman, but she still feels so. Okay. So how can she manage that? First of all, understanding, okay, that this is a problem of perimenopause or around the menopause. So even if she has stopped periods having a year back, she might have these feelings for another year or so, because that's the time body is adjusting to the new kind of system that she's subjected to. Is Hindi okay, or English okay, or should I talk in Hindi? One of you can.
Good evening, ma'am. Good evening, ma'am. Hello, am I audible?
Yes, I can hear you.
Yeah. Can you hold the language mixture of Hindi and
ओके
English?
मिक्स अच्छा मिक्स कर दीजिएगा, ठीक है। तो ऐसे में मीनाक्षी को क्या मतलब हाउ कैन शी मैनेज इट, क्या करना चाहिए? पहले तो ये बात है कि एक्सेप्टेंस, ओके, दैट दीज आर नॉर्मल फीलिंग्स। एक अकेली मीनाक्षी नहीं है जिसको ऐसा हो रहा है, बहुत सारे मीनाक्षीज ऐसे हैं कि जिसको ऐसा प्रॉब्लम होता है, और ये मेनोपॉज के साथ बहुत जुड़ा हुआ रहता है। दे आर वेरी इंटीमेटली अटैच्ड विथ मेनोपॉज। मेनोपॉज के टाइम पे बॉडी का हार्मोनल चेंजेस बहुत ज्यादा होता है हमारे शरीर में। एक्चुअली women go through these dramatical phases number of times, बहुत जगह पे ऐसा ऐसा ये होता है, अप्स एंड डाउन्स होते हैं। तो एक मेनोपॉज में भी ऐसा होता है कि ऐसा नहीं कि फीमेल हार्मोन निकलना ही बंद हो जाता है, बट जो फॉर्म में होता है वो फॉर्म चेंज हो जाता है, नाम भी बदल देते हैं। जैसे शादी के बाद औरत का नाम चेंज हो जाता है, सरनेम चेंज हो जाते हैं, वैसे भी हार्मोन्स का भी नाम चेंज हो जाता है, कैरेक्टर भी चेंज हो जाता है, रोल भी चेंज हो जाता है। तो ये जो फीमेल हार्मोन्स मेनोपॉज के बाद निकलता है वो बहुत ज्यादा प्रोटेक्टिव नहीं रहता है। it will still make you look like a female. There will be no major difference. That it's not that menopause के बाद आप मैन दिखने लगोगे, ऐसा कुछ भी नहीं होता है, बट देयर आर सर्टेन चेंजेस। वो जो पावर होता है ना मेंस्ट्रुअल हार्मोन्स में, वो पावर बिल्कुल कम हो जाता है। और ये जो ट्रांजिशन फेज है जहां से एक्टिव फॉर्म ऑफ हार्मोन से लोअर फॉर्म ऑफ हार्मोन पे जाते हैं, इसमें उनको बहुत ज्यादा बॉडी में रिएक्शन होते हैं, एंड ये रिएक्शन के तौर पे शी कैन फील डिप्रेस्ड, शी कैन फील एंशियस, समटाइम्स फिजिकल सिम्टम्स, ऐसा दिल धड़कने लगेगा कि लगेगा कि मुझे हार्ट अटैक हो रहा है। कभी कभी इतना गर्मी लगता है कि लग रहा है कि स्वेटिंग होता है कि लगेगा कि कोई हार्ट का प्रॉब्लम हो गया क्या। नींद नहीं आती है ठीक से, वजन बढ़ता है, और साइकोलॉजिकली ऑल्सो एंजाइटी बढ़ जाता है, डिप्रेशन, इरिटेबिलिटी। कोई कुछ बोल देता है तो एकदम से गुस्सा आ जाता है। कोई कुछ अगर नॉर्मल से सिचुएशन में बहुत भावुक हो जाते हैं, ओवर सेंसिटिव हो जाते हैं, रोने लगते हैं। दीज आर ऑल नॉर्मल प्रॉब्लम्स ऑफ पेरिमेनोपॉज एंड इमीडिएट पोस्ट मेनोपॉज। अभी 10 साल पोस्ट मेनोपॉज या 5-6 साल बाद ये सब सिम्टम्स नॉर्मल हो जाते हैं, लेकिन जो पहला 2 साल पहले, 2-3 साल बाद में ये सब प्रॉब्लम्स आता ही है। कैसे मैनेज करेंगे? फर्स्ट ऑफ ऑल acceptance that this is a new phase of my life and there will be changes in the hormones, and we'll have to adjust psychologically, emotionally, physically to this phase of my life. So that is the first एंड द मोस्ट इम्पॉर्टेंट थिंग है एक्सेप्टेंस। कभी कभी ऐसा भी होता है, हमारे पास तो बहुत सारे पेशेंट्स आते हैं और कभी कभी ये एज एक्सेप्ट करना बहुत मुश्किल हो जाता है किसी किसी को, especially those who are very want to keep themselves always young and stylish. They feel that they should never look young, they should never they should never look old, they should never feel old, or they should never have any change which makes them feel old. ऐसा नहीं होता है। नेचर के हिसाब से we will have to accept that the age is there. नेचर के हिसाब से we will also have to accept the good and the bad of the age. So acceptance is the first and foremost thing. Second, there are medications. Best is to lifestyle change करके modify करना। जैसे लाइफस्टाइल चेंज में थोड़ा डाइट में मॉडिफाई किया, थोड़ा एक्सरसाइज किया, थोड़ा ध्यान रखा खुद के ऊपर, तो these are the ways to manage them mostly. अगर ऐसा लगता है किसी को कि बहुत ज्यादा सिम्टम्स हो रही है, मुझसे मैनेज नहीं होता है, मेरा रिलेशनशिप खराब हो रहा है, माई वर्क where I'm working, I am getting disruptive in my work. My work is getting affected. My friends are complaining. My family is complaining, and I'm just not able to control my emotions. Then definitely we can start on medications, and most of these medications are very safe. They just need a supervision. So my message to all of you who are dealing with women around this age, or who are seeing women in your family at this age, or who are going through this phase themselves, my strong message is that you don't have to endure everything. अगर आपको लगे कि हाँ चलो मुझे एक सहारे की जरूरत है, कभी कभी थोड़ा a diet plan given by someone, or holding a hand of someone who can give you a guide of how to exercise, how to diet, that is also good. And sometimes you might have to take the help of medications also. How does she take care of her health in future, especially her bone health? Now menopause के बाद सबसे ज्यादा affected होता है bones. Bones का calcium का जो density रहता है, जिसमें मतलब bones में जो मटेरियल रहता है वो धीरे धीरे वो लॉस हो जाता है, बोन लॉस होते हैं, और वो मटेरियल धीरे धीरे लॉस होते होते पतला हो जाता है, बहुत ज्यादा पतला हो जाता है तो उसमें छेद हो जाते हैं। तो इसको हम मेडिकली बोलते हैं ऑस्टियोपीनिया और ऑस्टियोपोरोसिस। नाउ ऑस्टियोपोरोसिस कैन हैपन if osteopenia is neglected. Now at the age of 60, if somebody is trying to cure her osteoporosis, maybe she will not be able to be as effective at 50. Okay. I mean, at 60, she will not be as effective as the treatment is at 50. तो अगर 50 साल से ही जैसे ही मेनोपॉज चालू होता है, उसी से आप ध्यान रखना चालू करते हो, तो यू कैन प्रिवेंट और डिले द होल कॉन्सेप्ट ऑफ ऑस्टियोपोरोसिस। कैसे डिले कर सकते हैं? एक तो एक्सरसाइज, दूसरा है कैल्शियम, तीसरा है एक्सरसाइज में स्ट्रेंथ बिल्डिंग, मसल ट्रेनिंग। ये जो बॉडी बिल्डिंग होता है ना, वो एक होता है यंग एज में सब बॉडी बिल्ड करके बॉडी दिखाना चाहते हैं, बट इट इज वेरी इंपॉर्टेंट टू एक्चुअली बिल्ड बॉडी आफ्टर मेनोपॉज, क्योंकि स्ट्रेंथ जो है, मसल का जो स्ट्रेंथ है वो अभी ज्यादा इंपॉर्टेंट है, क्योंकि जॉइंट्स वीक होते हैं, मसल जो जॉइंट्स को होल्ड करके रखते हैं वो भी अगर वीक हो जाता है तो जॉइंट्स और भी वीक हो जाएंगे। इसके लिए मसल ट्रेनिंग, थोड़ा सा स्ट्रेंथ ट्रेनिंग, थोड़ा फ्लेक्सिबिलिटी, थोड़ा बैलेंस और थोड़ा कार्डियो, ऐसा मिक्स करके एक्सरसाइज करना चाहिए। कैल्शियम लेनी चाहिए। कभी कभी अगर फैमिली हिस्ट्री में ऑस्टियोपोरोसिस है, अगर घर पे किसी को मतलब मदर को ऑस्टियोपोरोसिस है या एल्डरली लोगों को ऑस्टियोपोरोसिस है, तो यू कैन प्रिवेंट दैट बाय टेकिंग एंटी ऑस्टियोपोरोटिक ट्रीटमेंट फ्रॉम द वेरी बिगिनिंग। Does she need a mammography? Now, if you see this picture on the right side, all of you can see the PowerPoint? Just give me one yes.
Yes, ma'am, we can
Yes. Okay.
see.
So if you see the right sided picture, menopause actually affects every part of a woman's body. जैसे menstruation affects every part of the woman's body, stoppage of menstruation also affects every part of woman's body. Hair becomes thinner, there is loss of there, there is a loss of the shiny part, then headaches होते हैं, hot flashes होते हैं, the teeth uh, becomes a little weak, gum weak हो जाते हैं, gum पीछे चले जाते हैं, teeth थोड़ा loose हो जाते हैं, breasts थोड़ा droop in कर जाता है, they also flatten, they are not anymore rounded. हार्ट में हार्ट अटैक और हार्ट डिजीज का मतलब इस्केमिक हार्ट डिजीज का रिस्क बढ़ जाता है. एब्डोमेन पे सडनली आप फील करोगे कि लूज हो गया है, टोनिंग जो होते हैं वो कम हो गया है. There is in the vagina, there will be dryness, itching, and there is also shrinking of the vagina. Bones become, thinner and fragile. The body hair is less. Pubic hair sometimes become thicker and darker, sometimes become lighter and sparse. And there can also in the urinary system be incontinence. मतलब यूरिन होल्ड करने का जो क्षमता है, यूरिन होल्ड करने का जो पावर है, वो थोड़ा कम हो जाता है. मेनोपॉज के साथ साथ इतने सारे चेंजेस आते हैं. ये ओनली मेनोपॉज बोलेंगे तो सही नहीं होगा, ये एज के साथ साथ भी होता है, बट मेनोपॉज के साथ ये ज्यादा होता है. सो इन अ मैन द एजिंग प्रोसेस माइट बी gradual, but the same aging process in a woman will be a little more dramatic, will suddenly look a little more aged because of the menopause. And so does she need a mammography? After 50, yes, mammography breast health देखने के लिए. आफ्टर 50 अगर आप सोनोग्राफी करेंगे तो शायद कुछ भी नहीं दिखेगा, क्योंकि बोन एकदम मतलब ब्रेस्ट टिश्यू में एकदम पतला हो जाता है. तो उसके लिए मैमोग्राफी जो एक्सरे होते हैं वो ज्यादा इम्पोर्टेंट है कि वो टिश्यू से आपका अंदर का सब कुछ दिखेगा. ओके, सो मैमोग्राफी इज वेरी इंपॉर्टेंट. सोनोग्राफी उतना इम्पोर्टेंट नहीं है. मैमोग्राफी इज इम्पोर्टेंट आफ्टर 50. कभी कभी मैमोग्राफी करने के बाद वो लोग बोलते हैं कि हमने देखा ही नहीं कुछ, देख ही नहीं सकते कुछ, बिकॉज वी आर नॉट एबल टू सी बिकॉज द tissues are still dense. Then you have to, they will only say that कि sonography कराओ. But usually mammography definitely after 50 हर 2-3 साल में एक बार कराना चाहिए. Remember, breast cancer is completely curable, completely 100% curable. आप डायबिटीज क्योर करने जाओगे तो क्योर नहीं होगा, आप ब्लड प्रेशर क्योर करने जाओगे तो क्योर नहीं होगा. ये हम लोग कंट्रोल करके रखते हैं मेडिसिन देके या लाइफस्टाइल चेंज करके, ये कंट्रोल में ला सकते हैं. लेकिन कैंसर इज वन थिंग विच इज कंप्लीटली क्योरेबल, provided you understand that it is taken, it is detected at an early stage, and it is effectively treated. Now, she has some fibroids in the uterus. At 50, if somebody has a fibroid in the uterus, does she really have to bother? After menopause, fibroids shrink in size up to a certain size. Let's say if the fibroids are 4 centimeter, 5 centimeter, fibroids are small overgrowth in the woman. And you must have heard about fibroids because बहुत कॉमन होते हैं. 100 में से 25-30 लोग औरत को ऐसे ही फाइब्रॉइड्स दिखते हैं. सोनोग्राफी में कुछ भी प्रॉब्लम नहीं है, लेकिन सोनोग्राफी में फाइब्रॉइड दिखता है. So not necessarily that all fibroids need to be treated, but if the fibroids are bigger than 8 centimeter in size, bigger than 7 centimeter in size, if the fibroids are rapidly growing, for example, at 49 it was 4 centimeter, and at 50 it has become 8 centimeter. These fibroids are risky fibroids. So definitely those fibroids need to be addressed. Otherwise, fibroids less than 5 centimeter do not have to be bothered about at all if they are not giving you any symptoms. Okay. Now coming to Vandana, let me introduce Vandana to you. 60 years of age. She's retired. She keeps herself busy with gardening and music. She enjoys travels with her retired husband. Her husband has now retired, and they both enjoy a lot of time together. And she's living a very happy life now. All those whatever she had, whatever Meenakshi had at her age of not feeling good, feeling low, that has all gone, and now she's living a very happy life. But few are the problems. Some of the problems really bother her and sometimes significantly bother her. One is that she finds it very difficult to hold the urine. Sometimes she says that while going to the toilet, mera ho jata hai. Sometimes I feel that I have already leaked before I can reach the toilet. Okay. Sometimes she leaks while uh, laughing aloud. 1 minute. Sorry. Can you all see this?
Yes.
Yes. So कभी कभी बहुत ज्यादा हंसते हैं, बहुत ज्यादा या खांसी होती है, तो she feels that a lot of urine is leaking. So can anything be done, or does she accept? She accepts that this is age and this is postmenopause. I'll have to live with this. Of course not. You can take treatment. You can do exercises again. See, at 60, if you start doing new exercises, you might not be as effective, but it is never too late. You can still go for exercises like bladder drill, like Kegels exercises, थोड़ा वो vagina और urinary passage और back passage का muscles को थोड़ा सा squeeze करना धीरे धीरे, और हल्का से pull करना towards your navel and धीरे से छोड़ना. कभी भी, ideally you should do it about 20 to 25 times minimum in a day. But even if you don't remember doing that, at least any time you remember, just do it. Do it as you squeeze it or release it. And a good time to do it also is while sitting on the pot. Okay, for urination. कभी कभी लगता है कि एकदम बहुत जोर से यूरिन लगा है, आप जाओ बाथरूम में, लेकिन बाथरूम में पॉट में बैठ के उसको कंट्रोल करने की कोशिश करो. एकदम कंट्रोल करके 1 2 गिनो, कभी 2 में निकल जाएगा, कभी उसको धीरे धीरे करके 5 गिनने की कोशिश करो, कभी 10 गिनने की कोशिश करो. अगर 15 तक आप गिन लिया, 15 seconds means not 1 2 3 4 5 6 7 8 9 10, 1 2 3 4 like seconds जैसा अगर गिन के, अगर 15 सेकेंड पॉट में बैठ के उसको कंट्रोल कर सकते हो, दैट इज अ गुड कंट्रोल दैट यू कैन मेक योर ब्लैडर टोन अप. ओके, दिस इज कॉल्ड अ ब्लैडर ड्रिल एक्सरसाइज. ब्लैडर को आप टोन करते हैं बिकॉज ऑफ एज, बिकॉज ऑफ मेनोपॉज, बिकॉज ऑफ लैक ऑफ हार्मोनल सपोर्ट. द ब्लैडर मसल्स गेट वेरी. Is somebody admitting people? Sakshi, are you doing that? Because all the messages are coming to me.
Yes, I'm admitting.
Okay, great. So, आप अगर ये ब्लैडर ड्रिल एक्सरसाइज कर सकते हो कि एक तो होता है कि आप अगर यूरिन बहुत जोर से जब लगी है तो ये एक्सरसाइज करना बहुत मुश्किल हो जाएगा. So you should go to the toilet before you actually feel like going to the toilet. Okay, that may be about 5 minutes or 10 minutes before you are actually feeling a strong urge. तो उसके पहले जाके आप उधर पॉट में बैठ के भी ये कंट्रोल कर सकते हो, और धीरे धीरे 15 को अगर 30 तक लेके जा सकते हो, तो any woman after 60, if they can hold urine for 60, I mean for 30 seconds sitting in the pot, she has achieved a bladder tone of almost at age of 30. Okay, the bladder muscles will be so young. But earlier you start this exercise, the better it is. However, even if you have missed the bus of 50, even if you start at 60, that is also useful, whatever useful it can be. If you're leaking while coughing aloud or laughing aloud or coughing, then that is called a weak pipe, okay, and weak support. So sometimes Kegel's exercise help, but at 60, if you start doing Kegel's exercises, this might not be so easily controlled. So sometimes if you go to a doctor, the doctor might suggest a small type of surgery to get rid of that. कब करेंगे ये सर्जरी, कब जाएंगे डॉक्टर के पास, ये तो होता ही रहता है, ये तो मेरा सेकेंड बच्चा होने के बाद से ही चालू है। कब ट्रीटमेंट लेना जरूरी है? जब आपका ऐसा ना बताया कि आप ट्रैवलिंग प्लान कर रहे हो आपके इसके हिसाब से कि मेरा निकल ना जाए, या आप अगर बहुत ज्यादा खांसते हो या आपको बहुत ज्यादा मतलब एक सोशल गैदरिंग में जाना है, तो आप डायपर पहन लिया कि निकल जाएगा, नहीं तो पूरा गीला हो जाएगा। आपको बार बार पैंटीज चेंज करना पड़ रहा है, आपका कपड़ा गीला हो जा रहा है, मतलब ऊपर से ऊपर का कपड़ा, खाली पैंटी नहीं, ऊपर का कपड़ा भी गीला हो जा रहा है। दैट इज अ टाइम व्हेन यू शुड नीड ट्रीटमेंट। Now, often Vandana also has some itching in her private parts, itching, burning, very uncomfortable feeling down there. She's not comfortable. Um, she feels that there is something which is always, feeling dry. I'm not feeling moist. I'm feeling कांटा चुभने का जैसा, बैठती हूँ तो भी लगता है, जलन जैसा लगता है. So these are all urogenital symptoms. बहुत burning होता है because the layer which is there प्रीमेनोपॉज में एक पिंक जैसा प्रोटेक्टिव लेयर रहता है, वो लेयर धीरे धीरे मेनोपॉज के साथ साथ निकल जाता है और रॉ एरिया बाहर आ जाता है. सो दिस कैन ऑल्सो बी ट्रीटेड इफ at all you have symptoms. We don't treat it unless you feel these symptoms. We will not treat Vandana if we only find a dry vagina. If the doctor says, yes, the vagina looks very dry, but Vandana feels fine about it, then we don't need to treat it. But if Vandana feels very dry, very burning, or very itchy, sometimes, very discomfort, uncomfortable around that area, then we can treat it with a number of things. One, we can treat it with vaginal moisturizers. Two, we can also treat with hormonal creams. Three, we can treat with, yes? Patient. India. मैं बोला उसको, but I had told गवर्नमेंट के साथ we got told him come, तो बोला हाँ ठीक, इसको प्लान किया तो पास है, तो कंफर्म नहीं तो कल शाम को हाँ ठीक ठीक I got okay. So if she feels that there's a lot of discomfort around this area, we can definitely do treatment. As I said, we can treat it with hormonal creams. We can treat it with different kind of vaginal moisturizers. If like Vandana feels that sometimes she also, mostly she doesn't feel like having sex, but sometimes she does feel like having sex. But while she's having sex, she's having a lot of burning and lot of dryness. Does she accept it just like that? No, she doesn't have to accept it just like that. We can give her lubricants. We can, as I said, lubricants while having sex. Also, sometimes we can give moisturizers for a longer period of time, which can leave the vagina moisturized and leave the vagina younger for a longer period of time. And what does she have to be mindful about her health? At 60, the most important thing is annual screening checkups. Okay. It is very important because after menopause, all your risk, which was, if anyone, all of you must have heard about cancers, women having cancers, women having breast cancers, women having uterine cancers, ovarian cancers. A lot of these cancers happen after menopause because the protective power of the hormones against cancer is also not there. So, not just because you have had menopause is not the end of all your problems. कि अरे मेरा तो मेनोपॉज हो गया, मुझे यार कोई टेस्ट करने की जरूरत नहीं है. एक्चुअली टेस्ट करने की और भी जरूरत है, बिकॉज मेनोपॉज के बाद आपका हार्ट, आपका बोन्स, आपका ब्रेन फंक्शन, लिवर फंक्शन, किडनी फंक्शन एज के साथ भी चेंज होता है, मेनोपॉज के साथ भी आपका चेंज होता है. सो इट इज मोर इम्पोर्टेंट नाउ दैट यू शुड गो इन फॉर रेगुलर screening checkups. Okay, so now my thing is that these are the main things that women at around little elderly or above 50 to 70 to 80 women have these kind of problems. Now if you want, I can go to other ages as well. Otherwise, we can spread the good words. The whole reason I always say this whenever I have these awareness talks, that I cannot go everywhere and spread awareness. When I give awareness to all of you, how many of you are now here? Whoever are here, you spread the good word to 10 other people. Okay, so that is how the word is spread. That is how the awareness is spread. Of course, Google is a big area for awareness. We are happy that Google is there because at least background knowledge badhta hai. But Google also sometimes misleads because you don't have a background knowledge. So we are here. The health experts are here. We can, we will patiently tell you what is wrong and what is right. And do not follow Google and make lifestyle changes without an expert advice. Yeah. So take proactive steps and take care of all of you. Thank you. If you want, Asha, you can tell me, or anyone, if you want, I can go to other ages as well. Should I go to other age? Does anyone want to know about problems of other age women?
Yes. 60 plus, 60, 70 plus.
60 plus, 70 plus is already we have discussed.
Okay.
So I'm stopping the sharing now, and I will be very happy to answer any question that you have. Is there any questions? I think a lot of women joined a little late. You.
Good evening, ma'am. Good evening, everyone.
Yes.
If any participants कोणाला काही क्वेश्चन असतील, किसी को भी questions रहेगा, तो we can take 3-4 questions and ma'am can answer the queries. So participants मध्ये किसी को questions है क्या? I think there
आप
is.
कैमरा ऑन करके भी पूछ सकते हो.
I think there are no questions from the participants. So Good evening, ma'am. On behalf of Graceful Living, I would like to thank you for your such a valuable time, and you have said such a beautiful PPT, and you have shared in deep such a great knowledge like that will be benefit to all the participants. So I thank you on behalf of Graceful Living and all the participants जिन्होंने ये session attend किया है.
Thank you.
Thank you, ma'am. Thank you for your time.
And I'm sure I still have about 5 minutes. So if anyone wants to ask any questions.
Yeah, we'll wait for 5 minutes.
Yeah, good evening, madam. Yeah, my name is
Yes.
Amrita. So I work also with Graceful Living. So, madam, regarding menopause, at what age does it start? Generally, does it start at 50?
No.
Or
So
is it
average.
huh? And also, is it genetic? If my mother has got menopause at a particular age, then will I have it the same way?
Very nice question. Actually, menopause is a sort of average that we call it. So the average age of menopause in India is about 48.
Acha.
The average age of menopause in the whole world is 51. ऐसा नहीं कि 48 में ही होना चाहिए वही नॉर्मल होगा, किसी को 46 में भी हो सकता है, किसी को अगर 45 के पहले हो गया तो उसको हम बोलते हैं अर्ली मेनोपॉज. अर्ली मेनोपॉज क्या इंपॉर्टेंस रहता है कि अर्ली मेनोपॉज में कभी कभी वी the need for hormonal therapy after menopause is a little more if they have menopause before 45. कि 45 years के पहले से ही अगर menopause हो जाता है तो the need for hormonal therapy is a little more. अगर 40 के पहले हो जाते हैं तो डेफिनेटली दे विल नीड हॉर्मोन्स, क्योंकि इनका बोन्स और ये हार्ट और ब्रेन परमानेंटली अफेक्टेड हो जाते हैं अगर 40 के पहले ही मेनोपॉज हो गया, और 40 के पहले मेनोपॉज होना इज एबनॉर्मल. सो दे विल नीड that hormonal support till about 44 or 45, and then we can stop them. Between 40 to 45 it depends. अगर बहुत ज्यादा तकलीफ होता है या कभी कभी थोड़ा सा तकलीफ होता है तो भी हम दे देते हैं. 45 and above is normal. We don't give hormones unless and until the woman absolutely needs it. And 50 के बाद definitely it comes to a absolutely world average age of menopause. Now coming to your second part of the question is, अगर mother को 50 में हुआ तो मेरा क्या हो? Hereditary genetic reasons और hereditary reasons definitely होता है. अगर किसी को family में सबको more or less same age में ही होगा. So अगर 50 में किसी को हुआ है तो more or less 48 to 50, 51 में ही हो जाएगा. अगर जेनेटिकली किसी को फैमिली में सबको 50 में हो रहा है लेकिन आपको 40s में हो गया, किसी को 40 में हो गया, that means there we have to find out other reasons why she had. So that is not very normal. So it is more normal to have menopause around the age what your family has, the other women in your family, maybe your mother, your sister, or even your bua and from the father's side, the women are from the father's side also.
Okay. Thank you, ma'am. Thank you.
You're welcome. Any more questions, Lalita ji, Viju ji, Veena ji? आपकी प्रेशर है ना मैम देवी मुझे उसका बिल्कुल okay then shall I take your leave?
Yes, thank you, ma'am. Thank you for your valuable time.
Always, always there. Have a great day,
You
all
too.
of you, and have a great, happy, and healthy living. Always happy, healthy, and graceful living. Okay, sure. Thanks.